Alrighty, again, welcome. It's November 10th. This is our virtual information session for the Occupational Therapy Assistant Program. We're going to introduce you to the faculty today. We'll talk about what is occupational therapy, where can you work as an occupational therapy assistant, what the job outlook is like, what our program is all about here at Lakeland, the admission requirements, what you're going to learn, our student association, and then again at the end we'll do questions. So right now the faculty is made up of two full-time instructors, myself. I'm the program director and I teach the courses. Graduated from the University of Florida. I'm an occupational therapist and I have experience in acute care, intensive care, medical surgical patients, orthopedics. I've also done some work with mental health patients and management. And then for the last 10 years, I've been in academics teaching occupational therapy assistant. My other full-time instructor is Ms. Jenny Lee. Jenny is our academic fieldwork coordinator and faculty member. She teaches courses as well, and she is the person who will be placing you in your internship opportunities. She is an OTA currently. However, she is a master's student at Muskegum, currently getting her Master's of OT. So that's one route that an OTA can take if they want to become an OT further down the line. She has experience in pediatrics, mental health management, and as of a couple of years ago, she joined our staff here and has become an academia. We do occasionally have an adjunct or a part-time employee that comes in, but the only two full-time instructors are myself and Ms. Lee. So the first thing I always like to start with when I do these in person is what is occupational therapy? Most people have heard of physical therapy and have even confused us with physical therapy. And when you first mention occupational therapy to people, they usually say, oh, I don't need that, I have a job already. Well, we're a lot more than that. We do work with physical therapists, but the difference between the two is that the physical therapist typically is the one who gives you strength and the ability to mobilize. The occupational therapist is going to take that strength and mobility and make sure that you can get back to living your life. We're going to help patients get back into their daily living skills of bathing and dressing, that they can work around their home, that they can attend school or a job. So we're really focused on functional activity, meaningful activity, purposeful activity, and promoting independence and daily life skills. We focus on what's meaningful to the client. Research shows that if people are involved in things that are meaningful and important to them, they will work harder at it with less complaints of pain, and they will make functional gains. So that's what we're all about in occupational therapy. What kind of work settings can an OTA work in? This is the great thing about occupational therapy and rehab in general, is that you can work with clients of all ages. There are occupational therapy practitioners who work in the NICUs with the premature babies. They work with newborns and toddlers, school-age children, adults with work injuries, trauma, and health issues, and then, of course, geriatric patients. Opportunities for OTAs exist in many medical settings like the hospitals, the rehab centers, home health care, where you go into the home and treat people in their homes, school systems, where you're working with the children in the schools in their classrooms. Nursing homes are a big employer of OT practitioners, and mental health facilities. The nice thing also about OT is that new opportunities are always developing in many non-traditional environments. There's a whole portion of OT that is learning more about home modifications and actually working with home contractors, people who build homes and making them accessible to the disabled and being a consultant in that process, helping businesses who need to make their businesses ADA compliant. That's the Americans with Disabilities Act. So becoming a consultant to make sure businesses are ADA compliant. This week in class, we were working with our students on how to evaluate computer workstations, because that's a whole other area of consultation where you can help people who may be experiencing neck and joint pain, wrist pain, or chronic pain due to their work environment. Driving consultations are out there for working with people who need to be evaluated for their safety in driving. And a whole variety of community programs are in development. And if you're an entrepreneur type person, develop your own community program. So there's a lot of what we call non-traditional environments that are opening their doors to occupational therapy, wisdom, and knowledge. The next few slides are some pictures that I put together for you to see OTs at work. Pediatrics is always popular, working with the children on their fine motor skills, on their social skills, on their handwriting skills, working both in and out of the classroom, working in inpatient and outpatient environments with the children. So that's always a really popular environment. Working in the clinics and nursing homes with the elderly, helping them get around with the use of a walker if they need it. You'll see this gentleman is learning how to get around a kitchen. So being able to get into his refrigerator, prepare a meal for himself, and safely get around his home so that we can keep him in his home as long as possible. We do a lot with adaptive equipment. How can we keep people independent? And if they can't do it on their own, can we provide them with different equipment that will help them? The gentleman at the top with his shoes is using a long-handled shoehorn because he's having trouble reaching his feet. In the middle, you see a shower chair and a shower nozzle, which is safer for people as they age or when they have surgeries to their hips, to be able to sit down, take a shower, and not be a risk for falling or hurting themselves. And at the bottom there is a woman who's using a reacher device. Instead of crawling out of her chair to try to grab something that's far away and risking a fall, she used her reacher device to grab onto items and bring them to her. Those are just a few of the hundreds of adaptations and modifications that we recommend out there. These pictures show working with the developmentally disabled populations on what we call their ADLs, activities of daily living. The therapist is working with this patient on getting his breakfast ready. So doling out himself some eggs, buttering some toast, looks like maybe actually egg salad on his bread and how to put together that sandwich. So helping the developmentally disabled populations gain some independence and be able to do some of their living skills. In some settings like nursing homes and mental health facilities, we'll do group treatments. This group's having a fun game of balloon volleyball, which in addition to social skills, works on range of motion, endurance, and their ability to stay active and keep their cardiovascular system working at as high a rate as it can. And we have specialized programs in hand therapy and orthopedics. In these pictures, you see people working with hand and wrist injuries, providing a splint to somebody. We actually did that last week in class where we taught our students how to make splints, because we are still making splints out in the clinics. And in that bottom picture there is measuring hand strength so that you can set goals for increasing the strength of someone's grip for functional activities. And then finally, different therapeutic activities that we have. The range of motion arc is helping her learn how to retire in light of a shoulder injury. The clothespins help with pinch and fine and gross motor skills. The nuts and bolts is good for a return to work program. And then TheraBand exercises are always used to help condition patients with functional living. So hopefully those pictures gave you an idea of the different things that we do. This is only a handful of it. There's lots of different environments and populations that you have the opportunity to work with. As far as the national job outlook, I investigated the U.S. Bureau of Labor Statistics. The need for occupational therapy assistants is currently expected to grow 32% over the next 10 years. And that is much faster than the national average for all occupations. And you can look that information up on that government website for yourself. According to the most recent U.S. News and World Report, they rank occupational therapy assisting as number 14 in healthcare support jobs and number 70 in the top 100 jobs of 2020. occupational therapy and occupational therapy assisting continuously and consistently ranks among the top jobs in the country. So what's our program about here at Lakeland? Well, we accept 20 students once a year, only in the fall. Now, that doesn't mean you can't start coming to Lakeland now to start your prerequisite and your general education coursework. But as far as the OTA class work, we start a class of 20 students every fall. The program accepted its first class in the fall of 2018, and this year we started our third class. So we have 3 classes going on right now of OTAs. We are proud to have earned our full accreditation from the Accreditation Council of Occupational Therapy Education. That was a 2-year process of preparation, and in April of this year, we were informed that we received the full 7 years accreditation. And had no areas of concern for the accreditors when they came to visit us here on campus. The program itself lasts approximately 2.5 years or 5 semesters. The first 2 years are on-campus learning in the classroom as well as clinical simulations. The final 4 months after you've finished up all of your classwork are full-time clinical experiences out in the field under the supervision of a licensed OT or OTA. This is something you have to prepare for because you will be working in the clinic as a full-time clinician, or I should say as a student clinician, and you will be doing that full-time work without any compensation because it is part of your education. So you will want to prepare for any changes or adjustments you'll need to make to your home life, your financial situation, your job, caring for children or loved ones, because you will be working full-time during those last 4 months. Those months are March, April, May, and June of your last and final year with us here in the OTA program. Once you finish the program and finish all of your clinicals, you will graduate from Lakeland. You're not ready to practice yet, though. You have to get a national certification. The national certification exam is the same exam that students all over the country take, and you only need to take it once in your career to get your national certification practice. But after you become nationally certified, you're not done yet. You have to also get a license in the state that you want to work in. So in the state of Ohio, you would have to go through the OT licensure board in Columbus to get your state license. Certification is usually renewed every 3 years. Licensure is renewed every 2 years. And you do, again, have to have both in order to start your practice. What are our admission requirements? If you've been looking online or through any of the printed materials, you will see that Lakeland has 3 admission options. Those options are for the high school student, the college student, and the advanced education applicant. We tend to focus on the college option as most people come in through that option, but we do have a few that come in through the high school option as well. So be sure that you are looking at the correct admission requirements. They are all similar in some ways, but myself or our academic counseling team can help guide you to the correct requirements there. The prerequisites for applying to the program are medical terminology and Anatomy and Physiology 1. We offer both of those courses here at Lakeland, and you can take them at any time, and you will have to take them before you can apply. The only exception to that is someone coming straight out of high school. They would take those 2 classes if they're accepted to the OTA program. They would take those first 2 classes along with their first semester of OT classes, but they would have to meet the minimum requirements to stay in the program. So everyone has to take medical terminology and Anatomy and Physiology 1. The requirement is you have to get a C or no lower than a C and a combined GPA of 2.5. So what that means is you can't get a C in both of them because that won't give you that GPA of 2.5. You need to have a C or higher in each course, and the combined GPA between those 2 courses has to be a 2.5. So you want to be aware of that. In addition to those prerequisites, I didn't put on here, there are 8 general education classes in psychology, classes in statistics, classes to prepare you for the program. You can take those other classes at any time before or during your OTA programming. But the only two classes you have to take before you start is Medical Term and Anatomy and Physiology 1. The next requirement is that you do need to attend a health technologies information session. They can do this virtually now in light of the pandemic. After you attend a technology information session, you can then meet with a counselor who will go through your transcripts and make sure you're on the right path to admission to the OTA program. And that is set up through our student services office that you can call at your leisure there and set up one of those health technologies information session attendances. You do need to have that. You also need to take what we call the TEAS test. It's a test of essential academic skills. Now, we are currently not taking any more TEAS testing, I think, starting Thanksgiving. Actually, we may have changed that because we did recently go to fully remote a couple weeks early. So you may need to wait. If you're at a place where you want to take the TEAS test, you probably need to wait until January. And that's done through our testing center here at the school, and the counseling office can help you schedule that. You do need to get a minimum score of 55 on the TEAS test to qualify for admission to the OTA program. You may have read that we had an observation hours requirement. We have lifted that requirement due to COVID. Nursing homes and health facilities certainly just aren't letting people who don't need to be there into their facilities right now. So we're going to actually be replacing this requirement with a video/essay requirement starting next fall. So I'll be rolling that out as soon as I work that out with the admissions department. But right now, there are no observation hours required. I do highly recommend, if you're going to apply, that you do a full study of what the profession is all about. There's lots of videos and materials online that can help guide you. You don't want to get into the program not knowing what occupational therapy is all about. So that's why we had the observation hours. Unfortunately, with COVID, that just isn't something that's possible right now. Once you get into the program, what are you going to learn? Well, we've tried to divide our curriculum up so that there's a common theme in each semester. Each semester does focus on one specific domain. Your first year in the fall, your very first semester, you will get all of your foundations courses. And I'll be looking over here to my right because I have all my courses on my dry erase board. So don't think I'm distracted here. You'll learn about the foundations of OT, where you talk about history, our supervisory requirements, the role of the OT and the OTA, our standards of practice, code of ethics. You'll also be involved in a class called Activities and Occupations, which students think is the best class because they get to do hands-on activities in line of crafts and other types of media to achieve therapeutic goals. And your first semester is also where you learn how to do your documentation as an OTA. The second semester, which is spring of year one, the focus is on developmental disabilities, in other words, pediatrics. This is where you'll learn all about how to work with children on the different issues that they have as far as handwriting, feeding, developmental issues, developmental delays, sensory integration. That's all happens in that spring semester. We also start your clinical simulations in that spring semester. So your clinical simulations will be done to get some experience in what happens in a pediatric practice. Also in that second semester, you'll have that functional anatomy and kinesiology course. In the first semester, which is the fall semester of year two, the focus is on adult physical dysfunction. So you're going to learn about what it's like to work with a hip patient, someone who's had a hip replacement or fracture, someone with COPD, called chronic obstructive pulmonary disease, someone who's had a cardiac surgery, arthritis, amputation, cancer. That's what we call physical dysfunction with adults, and that's what you learn in the third semester, which is fall of year two. You also take a class about neurological rehab during that semester, where you learn how to work with stroke, spinal cord injuries, and head injuries. The final semester that you're with us is our focus on mental health. Mental health is in everything that we do, but we really focus in on the OT's role in the mental health clinic and working with depression, schizophrenia, bipolar disorder. So you're learning how to run groups in mental health. And I should point out that both the adult physical dysfunction and the mental health also have clinical simulation practice. So you'll have experience in pediatrics, physical dysfunction, and mental health when it's time to go out for your full-time field work. In addition to the classes I mentioned, like anatomy and neurology, you will take a professionalism and management course. A lot of OTs are happy to hear that management positions are open for them if that is a track you want to pursue. There are a lot of OTAs out there who are serving as managers if that's a skill that you have. So certainly we want to have you depart Lakeland with at least some of the understanding of what it's like to manage a department. Our clinical simulations, these are known as our level 1 field work. We typically used to do these in person, but again, because of the pandemic and because of the amount of students seeking clinical experiences there, many programs in Lakeland have switched over to simulation programs. So we'll be doing real life simulations virtually to give you the experience in each of those semesters. You're also going to learn about administering standardized assessments and delivering treatment activities focused on pediatric development, range of strength, coordination, activities of daily living, and group activities. So we keep you busy here while you're in our program. The goal is that you would leave us with entry-level skills. We don't go into specific areas of practice that you would need continuing education to become more of an expert in. We give you kind of the whole range of skills needed to practice in any type of environment. And that's true of any OTA program. They're charged with providing you with entry-level skills so that you can get out there and start working. You are free to get more training if you want to specialize in orthopedics or vision rehab or pediatrics. There is certainly room for continuing education that you have to do. We also have a student club. It's called SOTA, the Student Occupational Therapy Association. This is a student-run club that has a faculty advisor. All of the officers are current OTA students. Membership in SOTA is open to any Lakeland student with an interest in occupational therapy. Meetings are usually held once a month, and currently we are doing these meetings virtually so we can get as many people involved as possible. And SOTA provides opportunities for networking with not only the other OTA students, but also with community resources. They like to provide community service. They do fundraising. And also for the general promotion of occupational therapy, both on campus and in the community. SOTA looks good on your resume. Being an officer in SOTA looks really good on your resume. So consider being part of SOTA as you get closer to your participation in the OTA program. This last slide here has my information, my phone number to my office, as well as my email. Should you need to contact me with specific questions, that information for you is right there. And I believe you'll be getting, Jessica can correct me, but I believe you'll be getting this PowerPoint sent to you, or at least the link to the recording. At this time, are there any questions? I'm going to close out my screen so I can see the chat box and also see if anyone has any questions. So you're going to see the PowerPoint disappear. And I don't see anything in the chat right now, so feel free to either unmute yourself and ask any questions you have, or type in a question with the chat. So we have a question there. Okay, go ahead in the chat, Mary. And Jessica did confirm that she'll be sending you out a link to this recording, so you can review it and share it with anyone who wasn't able to be here. Mary's question is, can I tell you where my current students are looking at jobs and what specifically they are interested in? What kind of OTA work? Most students come to us either knowing exactly what they want to do in the beginning, but then when and usually that's pediatrics or adults with orthopedic injuries, but then they get out there and they start learning more about all the different populations. And they realize that working with the geriatric population at a nursing home is actually a lot of fun. And they tend to change their thinking and become more open-minded. I've had a lot of students. I've been here at Lakeland since the program started, but I taught for 7 years at another institution, graduated 16 classes. I've had so many students who said, "Oh, I just want to work with kids," but then they go out there and they experience different populations and they become more open to working with geriatrics. Your most of your job opportunities are going to be in the nursing homes. Sometimes you'll find opportunities in the hospitals. Nursing homes are big. Orthopedic centers, you occasionally can find an opening. And pediatrics, you can usually find openings. But please keep in mind, some of those specialized clinics you have to be a little patient for. But there are certainly jobs out there. The current students are, we're just in the process of graduating our first class, so I don't have exact employment information for you. But I do know that our very first grad has already been hired in the school system and will be working in pediatrics as soon as she passes her exam and gets licensed. So that's perfect. We had a question from Sarah. She says, "I've heard that OTA is being phased out. What are my thoughts on this?" I've heard that talk for years, and I don't see it happening. We have a national organization called AOTA, the American Occupational Therapy Association. You can find them online at aota.org. They work very, very hard with legislation to make sure that we are fully represented at the table, both OT and OTA. There are some things coming down the pike where they're messing with how much are they going to reimburse an OT versus an OTA to a facility, which is making facilities think about how many OTs versus OTAs they want to hire. But I truly don't see them phasing out OTA. There's always changes with billing and reimbursement. We can't control that. All we can do is trust in our national organization and our people on the Hill who are fighting for us and making sure that we have a place at the table. So I don't see, Sarah, OTA being phased out. If anything, I think you're going to see, in light of COVID, I think you're going to start seeing people leave the field and retire because of all the extra COVID retirements, all of the COVID requirements. And I think you're going to see the job market open up a little bit more. That's what I'm thinking will happen in the next year or two. But yeah, whether OTA is being phased out or not, I feel pretty confident saying that OTA is not going anywhere, and we're not going to allow it to go anywhere soon. Mary asks, for people who work in nursing homes, does the nursing home employ them or an agency? It's actually both, Mary. Nursing homes sometimes have what's called in-house therapy, which means that they hire their own therapist and you actually work for the nursing home. Other nursing homes have contract therapy, which means they've hired a company to staff their rehab center. So you may then, in that case, end up working for a company who hires you and places you in that nursing home or has you travel from 2 to 3 different nursing homes within their system. So there's really a little bit of both going on. You can work for the nursing home if the nursing home is in-house therapy, or you can work for a contract company. Contract companies have the option of sending you to different facilities, or you can be placed at one facility depending on the demand. So there are opportunities for both there. That was a good question. Jessica's posting some good information for you about admission. Currently our application fee is being waived. So you can, if you're ready to apply for the Occupational Therapy Assistant Program, that application fee is being waived. Spring registration has just opened up. So if you need to take those prerequisites and get them done, you can certainly register for Health 1215, which is medical terminology, or for Anatomy and Physiology 1. You also can go online and look up our health technologies information sessions and get yourself scheduled to one of those as soon as possible, which will open yourself up to meeting with a counselor to review your transcripts if you have any transfer credits. Maybe you're ready to apply for the OTA program in the fall. Let's get you going. The 1 year we closed we reached our 20-person limit in April. Last year, because of COVID, it was a little bit later, but we did fill all of our spots. So I do anticipate filling all 20 of our spots. We've already got a couple of the spots filled for fall already. So it's never too early to apply, especially if you got all the prerequisites done. So get yourself signed into a health information session so that you can meet with a counselor. Jessica's asking, what is the age range of our students? Do you have people who already have a bachelor's degree in something else? Yes, we do. We have students who come here looking for a second career, who have raised their children and taken care of their loved ones, and now it's time for them to pursue their wants and needs. So they're seeking a career. Our current class has students anywhere from the age of 19 and 20 all the way up into their 50s. So a lot of students are coming from all walks of life in order to learn about and become an OTA. So whatever age range you are, whatever reason you're seeking a new career or a first career, you're going to find a lot of people in the same boat within our OTA program. Are there any other questions that I can answer? These are great questions, guys. You can either unmute yourself and ask or type it into the chat. What do I love about OTA or about OT and OTAs personally? When I first started looking into what I wanted to do, I started looking at PT. I had spent some time in the hospital environment with my father, so I was getting to see all the things people were doing in the hospital, and I knew that's kind of the environment I wanted to work in. So I started looking, but I didn't want to be a doctor. I thought, oh, that takes forever, and even though I liked surgeries and looking at videos of things like that, it just seemed like it was going to take forever. So I decided to look at the rehabilitation side of things, and I looked at physical therapy. And physical therapy led me to information about the other therapy, occupational therapy, which now is the #1 therapy, if you ask me. Occupational therapy, there's so much creativity that the therapist can use. You can take any activity that is important to your client, from gardening to playing bingo to making tea, or even some exercise if that's what you choose. And you can make it therapeutic and fit within the scope of the OT practice and help people get back to living their lives. And that's what's important to me about it being an OT. PT is great, speech therapy is great, athletic training is great, but OT is really the only one that focuses on what's important to people and getting them back to living their lives. And that's the rewarding part about it. And I love sharing that information with my OTA students. Like I said, I've been teaching now for 10 years. Of the 20 years, how many years have I graduated in 96 from the University of Florida. So I've been out for quite a long time, and last 10 years I've been teaching, and I love sharing my experiences and then checking on my students afterwards and seeing what they've become out in the field. So that's what I love about OT is the openness and the creativity. Yeah, it's definitely people profession. You got to like working with people. You got to know how to deal with people. We spend time talking about therapeutic use of self in our program. And that's how do you use your experiences and your personalities as a treatment tool in engaging people into what you're doing with them. And when you can make that connection with a person and they look forward to seeing you because of what you're providing them, that's where your reward comes in and you'll leave work smiling every day. It is demanding. It's a physically demanding job depending on what setting you work in, but it is a hugely rewarding job as well. Anyone else have anything you're just dying to ask? This is the time to do it. No question is too small. You're free to email me or call me if you need to do that. I'm going to type into chat my email and my office number again, in case you didn't get it right off the bat from the PowerPoint. There's my email and my number in my office. I always have to look because I don't know it yet. Okay. If you need, the best way to reach me, because we're really busy with classes throughout the day, is to drop me an email and I'll try to get back to you within 24 hours. If you absolutely need something right away, just give me a call and I'll call you back as soon as I'm free. I thank you all for coming. I hope that this information was helpful to you and solidified your decision to become an OTA. If not, and it directed you in a different direction, that's good too. I have students who come to me and say, well, it wasn't quite what I thought. That's okay. I want you to go into the field that fits you and fits your wants and desires. So if that's OTA, great. I look forward to seeing you. And if it's not, I wish you all the best. I'm going to turn it back over to Jessica, and she'll wrap this up for us.